So Steve is a registered general nurse and head of education and professional development at the INMO. He's worked in a number of organisations in the UK and Ireland, including Tala Hospital, the NMPDU in the Eastern Regional Health Authority, and for 14 years, Steve has been in the Royal College of Surgeons as Programme Director on the MSc programmes in Institute of Leadership. So I welcome Steve.
Okay, it's great to follow on from Bonnie and Melissa in the Daisy Foundation. We did some work with the Daisy Foundation over the summer and became a supporter of the foundation and the awards, and that gives a positive spin in relationship to nursing, and in terms of recognizing the contribution of nurses, which I think is a vital aspect of what we do. Now, what I'm going to be talking about today is a psychological survey that we carried out late August and into September. One of the things we recognised was that that as well as the physical impact of COVID, which was very apparent, was also the psychological and emotional impact that was being experienced by nurses and midwives internationally. And our interest was to see how nurses and midwives in Ireland were being affected by COVID-19. So we carried out this probably in the period where there was a drop in infection rates and also in terms of the death rate. So part of the reason for that was just to allow some time in terms of after the peak to see whether there was any sort of longer lasting impact as well. And we all know that the figures are picking up again now, so this will have significance into the future. So the context is COVID-19. So that was the driving force, because it was something that was new to us, and it was something that was having an overwhelming effect internationally and also nationally within Ireland in all health services, particularly within the critical care areas and also within the residential care of the older person services as well. But one of the things to recognise is that the psychological impact upon nurses of caring has been recognised for decades. Issues around burnout have been reported on since the 1980s. People like Christina Maslach first introduced that term, and it applied specifically or more specifically to nurses than any other group. Now, it has developed since the 1980s, but burnout is very much a term related to nurses and midwives. Emotional labour. Nurses and midwives are emotional labourers. They carry the burden of the care and also the suffering and what they see on a day-to-day basis, which can result in compassion fatigue and, as Edward mentioned earlier, moral distress. So the survey that we carried out, it was an online survey. We used SurveyMonkey. We opened it up to all nurses and midwives in Ireland. So we were specifically targeting members of the INMO through our networks and our membership database, but also we opened it up on social media. So it was open to all nurses within the country. And the measures that we looked at were demographic information to give us some sort of background information about participants, and then we measured 4 different key areas. One was related to COVID specific questions. So these were nominal type questions, whether people had experienced various aspects of COVID. And the other 3 components were highly validated measures that have been established and recognized internationally as measures for impact of events, which has been used as a proxy for post-traumatic stress disorder. It's not a measure of PTSD, but it's used as a proxy. Also the burnout assessment test, the BAT. We selected that because that was a new test that has been validated in Europe by Wilma Shefeli and colleagues and was only released in July 2020. That was an update on what would have been traditionally used, the Maslach burnout inventory. And we also looked at professional quality of life ProQual. Just to say that what my focus in today, because I've only a short period of time, I'm going to focus on the COVID specific questions and then the burnout assessment tests. But we will report the impact of events and pro-qual questions separately within the World of Irish Nursing and Midwifery and other journals as well. And just to say, almost all of the results that I'm going through today have been reported in WIN. So our response rate was 2,642. Now, when we compare that with other surveys that have been carried out on nurses and midwives during COVID, that's actually quite a high response rate. When we look at our colleagues in the American Nurses Association, what we find is they have response rates around about 10,000 nurses. But if we compare the size of the country and the nursing and midwifery population, we can see that our response is much in excess from a percentage point of view than even our colleagues within America. As we would expect, 96% of respondents were female, and when we asked their registration, so obviously nurses and midwives have multiple registrations, or many do, we can see that 84% were RGNs, midwives accounted for nearly 4%, 8% for RNIDs, and so on. So we do have a spectrum of respondents from the nursing and midwifery family. Just keeping an eye on the time. So just some of the COVID-related questions we asked: did you or do you care for patients with COVID? And we've seen that the overwhelming majority had cared for patients with COVID, over 60%. Did you care for a patient that subsequently died of COVID? And we can see 52% had experience of caring for somebody that had died. Now that influenced some of the responses to the other questions because they were related to whether the person had experienced or cared for somebody that had COVID. Now we also were interested in the impact directly upon the individual nurse or midwife. So we asked whether they contracted COVID-19, and we can see 12% contracted COVID-19, which is a high percentage within the profession. And Howard has already talked about the impact internationally of COVID, and quite often how difficult it is to find information in terms of infection rates. And the other question we've asked is, if you contracted COVID-19, are you currently experiencing long-term physical effects of COVID-19? And again, this is a major issue that is emerging, long COVID, and we can see that 73.2% reported that they were still experiencing the longer-term physical effects of the virus. So I'm going to go through literally a number of these slides, and I'll give some more detail around burnout. Do you believe that your experience of COVID-19 has had a negative psychological impact on you? Now, this is a huge result where we can see that over 80% of nurses believe, so this is self-reporting for themselves, that COVID-19 has had a negative impact. And if they believe it's had a negative impact, it's potentially going to have some negative consequences unless there are coping resources in place to support those individuals. And when asked in relation to their colleagues they work with, did they feel that COVID-19 had had a negative impact, psychological impact on their colleagues, we can see that the number jumps even further to over 95%. So we can see this is a real issue that has been reported and is having a substantial impact on our nursing and midwifery workforce within Ireland. So it's an issue that does need to be addressed, and it needs to be brought to the forefront. So we wanted to know what type of things that people were experiencing. So we asked a number of questions around whether individuals, when they were off duty, whether they'd experienced things such as forgetfulness. And we also measured this in a different way later. And we can see a third of individuals had experienced forgetfulness, probably as a consequence of stress, as the psychological impact that they were experiencing. So they find it difficult to attend or to focus as well. and trouble concentrating. So all of those are linked. They're potentially going to have an impact in terms of work performance. So in terms of the individuals, in terms of patient safety, individual safety, they could have an impact, particularly around concentration and focus. And then remarkably, we've seen that over 90% reported that they had mental exhaustion. And it's important to highlight, and I'll repeat this later, that that is the key characteristic of burnout. So we can see that 91% were reporting mental exhaustion. Now, this really was quite a shock to us when we looked at this. When asked the question, have you experienced, has your experience of working with COVID-19 caused you to consider leaving the profession? So it's not to say they will leave the profession, but it's something they have considered during COVID. We can see over 61% reported that they have considered leaving the profession. So this is likely to have an impact, or something that needs to be considered, particularly as we go forward after COVID, in terms of what the legacy of COVID will be in terms of the nursing and midwifery workforce, and in terms of whether it will have an impact in terms of retention of staff. So we also asked a number of questions. We asked them whether to state whether they agreed or disagreed with statements around that experience of COVID in the workplace. So and you can see that the scale along the top, blue is, the darker blue is strongly agree, and the lighter blue at the other end is strongly disagree. And orange is somewhat agree, and the grey in the middle is neither agree nor disagree. So we asked, have you experienced stress in securing childcare? Because that has been a major issue for some nurses and midwives, and has come up during the course of the COVID pandemic. And we can see almost a third of nurses, so that's the light blue and the orange, reported that they have been stressed by this issue. Have they experienced stress in relation to spreading infection to their family and housemates? So in terms of their concern about that, and we can see 90% of nurses have been concerned about that, nurses and midwives. Are they confident in their employers' ability to keep them safe? And we can see again a third believe that they are confident. So we can see obviously the other figures where they're not confident. The correct PPE is available in the workplace. And you can see that the majority overwhelmingly believe that it is, but worryingly, there is still a significant percentage, nearly a quarter, that say that they disagree or they strongly disagree. And we can see 80% are concerned about their own personal health and their risk to coronavirus. And when asked, do they believe that testing should be carried out in the workplace, we can see there was overwhelming support, 90% for that. Now, what I'm just going to talk about is around burnout and the dimensions in the burnout assessment test from Shefeli and colleagues. So it is a new test. It is a validated scale. It goes beyond Maslach's scale, which focused on exhaustion, cynicism, and inefficiency. So these are just a snapshot. They're not all of the questions, but we can see under exhaustion, 61% reported feeling mentally exhausted. So we compare that with the previous question, when we actually add in sometimes into the scale, so the scale is never to always, and sometimes in the middle, we can see that it hits 94%, which is similar to the other score reported. A half reported that everything they do at work requires greater effort. I'm not going to go for every single one, but 70% report that after work, they find it hard to recover their energy, again, which is an important component of burnout. Mental distancing provided some surprising results. A third struggled to find enthusiasm for work. Almost a third again reported that they do not think much about what they are doing at work and are in autopilot. Nearly over a quarter, often or always, feel a strong aversion to work. Now, it's important to remember that these are likely to be, as part of the COVID stages, or the burnout stages are likely to be a product of burnout. 20% feel indifferent to their job, 42% reported they are cynical about what others feel about the work that they do. And then just two other aspects, 12% reported they are often or always unable to control emotions in work. 17% reported they're often irritable about things that don't go their way. And 42% reported they are sometimes to always upset and sad without any reason. Cognitive impact, I've already mentioned that. A third reported difficulty concentrating, focusing, and forgetfulness. And then just two other aspects. So there are 34 questions in total on this scale. These are the additional ones. First one is around psychological distress. A third of respondents reported that they sometimes to always have palpitations or chest pain. So the majority were in the sometimes category. A third reported that they often suffer from headaches, and 50% often to always suffer from muscle pain. And when added in the sometimes, we can see that goes up to 83%, and that includes neck, shoulder, and back pain. And psychosomatic complaints, 58 reported that they often or always tend to worry. Again, 36% in the often category. And 50, and this again is a surprising finding, 51% reported that they sometimes, above a quarter, to always feel anxious and suffer from panic attacks. So we can see there's quite significant impact around burnout and the psychological distress associated with burnout. One of the things I just want to highlight is just to say that burnout shouldn't be viewed from a negative point of view for the individual, because it should always be remembered that burnout can only exist if the person has burned brightly for a period. So they, in effect, the person who is burnt out has expended all of their energy. And that's why the burnt match image greatly illustrates in terms of the impact of burnout. And we can see when the match is lit, it burns brightly, but eventually when the person has nothing left to give, they've then burnt out. And that's an important component to understand. Probably some of the things I wanted just to highlight in terms of particularly around burnout, because that's the focus. Burnout is a motivational theory. It is a theory that goes back all the way back to the motivational theorists from the 1950s, Hertzberg and so on. It is focused in the domain of emotional and psychological effects on the individual. So it's how the individual perceives the world and the emotions that result. It has been seen by some as the antipode to work engagement, not by all. So work engagement has been introduced as the polar opposite for some who look at burnout. And the other important factor is that it is contagious. So it can have a crossover effect in terms of an individual's life at home. So it can impact how the person takes things back home. And it can also spill over in terms of the individual's colleagues as well. And that's why it has a contagion effect. And at the heart of any intervention or understanding burnout and also the psychological distress that comes with it is an understanding of the demands and resources model. This is what underpins burnout and has been extensively researched for nearly a quarter of a century. An increase in demands with a decrease in resources results in pressure that can result in lack of engagement, then leading to burnout. And there are many interventions that can be introduced, both at the individual level in terms of coping skills, social support from colleagues, but also organizational and system level interventions as well. Just to say, many of the focuses have been on the individual responsibility around resilience and coping mechanisms. Christina Maslach in 2018 made it clear that organizations need to step up to a greater extent. It's not all about trying to upskill the individual in terms of coping mechanisms. The demands need to be reduced to allow the circumstances for burnout to be removed or reduced. And I know that I'm coming up to the 20 minutes. I just have 2 slides just to go. The importance for managers is apparent because it's the people that we manage and also ourselves in terms of are impacted by burnout and the consequence of care. But probably the most most developed discussion around work engagement polar opposite burnout is by Macy and Snyder in 2008. And we can see that the psychological impact, which is circled in the state engagement, involve things as satisfaction, involvement, and commitment at work. But the psychological factors then can lead to behavioral changes, and it's important to know which one leads to the other. But you can see in the bottom area that one of the key mediating factors that have been highlighted is leadership. Transformational leadership has been seen as a mediating factor to reduce or remove the impact of burnout and to promote engagement. And I'm just going to finish up with this slide and one more, just to say that we have also been concerned about the impact of COVID-19 on our Black, Asian and minority ethnic nurses. And we carried out a survey also in the summer, and we will be monitoring that situation because we are looking to the UK and to America and have seen the increased numbers in this community that have been impacted by COVID-19. And just my concluding comments is that we need to recognise the impact of COVID-19 on nurses and midwives. We need to monitor that impact on a continual basis, both the short-term and long-term impact, both physical and psychological. We need to ensure that things such as PPE are provided in a sufficient amounts to meet the requirements. That staffing is an important issue that needs to be continually monitored to ensure safe staffing, and that action must be taken to prevent the impact of psychological impact of COVID-19. And it's important to draw upon the values of nurse and midwifery, compassion, care and commitment, and to apply them both to our patients, the users that we serve and we care for, but also likewise, we need to also apply them to nurses and midwives. And I'm going to leave just on that point. So if anyone has any questions, I'm happy to take those questions as well.
Steve, we have no questions, but I think also it's worth mentioning that your survey, the INMO survey, is reported in the World of Irish Nursing and Midwifery in November 20 for people to get more information.
That's right, yes.
Yeah, and I loved your fourth slide, I suppose, the crossover and the spillover, and I felt you gave us a lovely, concise and comprehensive explanation on burnout there. So thank you, yeah. Steve.
Yeah, just to say as well that we have a lot more data and we will be reporting on that as well.
Great. Thank you very much, Steve.
All right. Thank you. Thanks, Fiona.
Thank you.